Welcome to the What Does Science Say channel. We often think of cancer as something that happens to other people, or that it's just caused by these big, obvious lifestyle choices. But what if the most important clues are actually these subtle whispers from our own bodies, whispers that we're accidentally ignoring? Today, we're going to decode those whispers, because understanding them can literally be the difference between a late-stage diagnosis and a story of survival.
Okay, let's get right into it, because the stakes here, well, they could not be higher. When cancer is caught at stage 1, the survival rate is an incredible 90%. That's amazing. Early detection truly saves lives. But what happens when we miss those early signs?
Well, the picture changes, and it changes dramatically. At stage 3 or 4, that survival rate just plummets to a mere 5%. And get this, the World Health Organization has found that in many countries, a staggering 70% of cancers are diagnosed in these later stages. That huge gap between 90% and 5%, that's where awareness comes in. And it's exactly why knowing these early signs is so incredibly important.
So, to spot the signs, we first need to understand what we're even looking for. What is cancer really?
At its very core, it's basically a breakdown in our body's normal, orderly process. See, your body is made of trillions of cells that are supposed to grow, divide, and then die in a very controlled way. But sometimes, maybe due to DNA damage or some other trigger, that whole process just goes haywire. Abnormal cells don't die when they're supposed to. Instead, they just keep multiplying out of control.
And this is where a really crucial distinction comes in. Not all tumors are the same. As you can see here, benign tumors are kind of like contained problems. They grow, but they stay in one spot. Malignant tumors, on the other hand, well, those are the ones we call cancerous. They're invasive, they can spread. And that's exactly what makes early detection so critical.
And that brings us to the heart of this explainer. Understanding these 9 signs can empower you to really listen to your body and to act early.
The first sign is something a lot of people might just brush off. A sudden and totally unexplained loss of appetite, or losing a significant amount of weight when you're not even trying to. This can happen because cancer cells can release substances that travel up to your brain and actually disrupt the hypothalamus. That's the area that controls your hunger cues. You just stop feeling hungry.
But how do you know what's normal? We all fluctuate, right? This chart breaks it down perfectly. Just look at the triggers. Normal weight loss is usually explained, you started a new diet or you've been hitting the gym. But with cancer-related weight loss, there's often no clear reason at all. And notice the duration and symptoms. It's prolonged, lasting for weeks or even months, and it often comes with this deep, unshakable fatigue.
Next up is a sign that can be really unsettling. A persistent fever or these drenching night sweats, but you don't have any obvious infection. This is often linked to cancers like lymphoma. And what's interesting is, just like with appetite, it's about cancer cells releasing chemicals that interfere with the hypothalamus, basically hijacking your body's internal thermostat and cranking up the heat. Our third sign is one you can actually see with your own eyes, a change in a mole's size, shape, or color. This can be an early sign of melanoma, which is a really serious form of skin cancer. Sun exposure can damage the DNA in our skin cells, causing them to grow uncontrollably.
And here's a super practical tool you can use right now. It's called the ABCDE rule. A is for asymmetry. Does one half of the mole look different from the other? B is for border. Is it irregular or kind of fuzzy? C is for color. Is it uneven with different shades? D for diameter. Is it larger than a pencil eraser? And maybe the most important one, E for evolving. Is the mole changing in any way? That's a huge sign to get it checked out.
On to number 4. We all get coughs, but the key word here is persistent. A cough that lasts for more than 3 weeks, especially if it's not getting any better or is maybe even getting worse, can be a warning sign for lung cancer. A tumor in the lungs can irritate the airways. It's kind of like something is constantly blocking a straw that you're trying to breathe through. Your body's natural reaction is to cough to try and clear it. And as this slide shows, a normal cough from a cold usually gets better in about a week.
But a cancer-related cough just lingers, it gets worse, and it often comes with shortness of breath or fatigue.
The fifth sign is a crucial one that really requires self-awareness: a lump or swelling in the breasts or testicles. For both breast and testicular cancer, early detection so often comes from noticing these changes yourself.
Now for a quick pause.
You are listening to us from What Does Science Say? As we continue, it's so important to know what's normal for you. For women, breast tissue naturally changes with the menstrual cycle. A concerning lump is one that's persistent and feels different from all the surrounding tissue. For men, testicular cancer often shows up as a painless lump or just a feeling of heaviness. The key for everyone is doing regular self-exams so you know your own baseline.
The sixth sign is often ignored because, and this is the tricky part, it can be totally painless. Unexplained blood in your urine or stool. Blood in the urine can be a sign of kidney or bladder cancer. Blood in the stool could point to colon or rectal cancer. And while other, less serious conditions can cause this, it's something that should never, ever be ignored.
Our seventh sign is difficulty swallowing. If you constantly feel like food is getting stuck, or if you have this persistent heartburn that just won't quit, it's worth paying attention to. A tumor in the esophagus or throat can physically block the passage, making it really hard for food to travel down.
Sign number 8 is another gut-related issue: persistent indigestion or feeling full after eating only a small amount of food. A tumor in the stomach can interfere with acid production and the whole digestive process, leaving you feeling constantly bloated or full when you really shouldn't be.
And finally, our ninth sign, a change in your voice, like a persistent hoarseness that lasts for more than 3 weeks. Our voice is produced by our vocal cords. Well, a tumor on or near those vocal cords can affect their movement, and that can result in a voice that's weak, raspy, or strained and just doesn't go back to normal.
So, after reviewing all 9 of these signs, the message isn't to be scared, but to be aware. Knowledge really does put your health back into your own hands. The most important takeaway from all of this is that time is everything. Cancer is most treatable when it's caught early. Don't ever dismiss a symptom just because it seems small. Remember this really powerful idea: going early is half the battle won. So we'll leave you with this question to reflect on. Being mindful of these changes is the first and most important step you can take. Your body communicates with you all the time. Learning its language is a form of self-care.
Thank you very much for watching the video. If you have not subscribed to our channel, be sure to subscribe and set the bell icon to the all option so that if we upload a new video, a notification will come to you and you will be informed. Please don't forget to like and give us energy with your beautiful comments. And send this video to your loved ones so we can be seen more.